should go ahead and get started. Welcome everyone, and thank you for joining us. If you could please log in the chat with your name and organization, and we'll get started. So this is the telehealth, the PBTRC telehealth HUI meeting. And before we start, I'd like to give a quick overview of PBTRC. So go to the next slide, please. So as most of you know, PBTRC is the Pacific Basin Telehealth Resource Center, and we're one of 14 HRSA-funded telehealth resource centers in the country. There are 2 national centers, one that's focused on policy, that's CCHCP, and one that's focused on technology, that's TTAC. And the rest of us are regional telehealth resource centers that cover, as you can see, the color here covers entire country and territories. So I am Christina Higa. I'm the co-director of the Pacific Basin Telehealth Resource Centers that covers the state of Hawaii, as well as the Pacific Island territories and the Pacific Island Freely Associated States. I wanted to turn it over to Deb Peters, who's the co-director of PBTRC, to introduce herself.
Hi, I'm Deborah Peters. I am co-director along with Christina of the Pacific Basin Telehealth Resource Center. We've been doing this. We've been doing the co-director thing for like, what did we figure it out? Like 7 years, 8 years now? Okay, something like that. I thought I was only going to do it for a couple, and it turns out that it's been a whole lot more successful than I think even we envisioned. But anyhow, welcome, and I'm going to turn it back to Christina.
Thank you, Deb. Next slide. And so today we're really excited. I mean, the timing couldn't have been more perfect with the announcement yesterday of the program opening. And so I'm really happy to turn it over to Megan O'Toole to open up the session.
Great, thanks, Christina. Hi, everyone. My name is Megan O'Toole, and I'm Senator Schatz's Senior Health Policy Advisor. So I just wanted to say thanks to all of you and to the FCC for joining us today to discuss the COVID-19 telehealth program, and to Christina for organizing this discussion. So just a quick level set, I'm sure you all know this, but in response to the COVID pandemic, Congress has appropriated millions of funds to the FCC to provide healthcare providers with funding for broadband services and connected devices. But no healthcare providers in Hawaii were selected to receive support through the first round of funding. And the applications for the second round from funding from the December COVID relief bill will be accepted from April 29th to May 6th. So we appreciate the FCC making some time to chat with us to explain the program further and to detail the evaluation criteria for participation. So I'll turn it over to Stephanie at the FCC now. Thank you.
Good morning, good afternoon, everyone. I'm Stephanie Minnock. I am an Assistant Division Chief in the Wireline Competition Bureau of the FCC. And I'm excited to talk to you today about the COVID-19 telehealth program, which, as Megan noted, was established in response to the COVID-19 pandemic. The first round of funding was appropriated last March as part of the Coronavirus Aid, Relief, and Economic Security Act. Congress had appropriated $200 million initially. During the first round, we funded 539 applicants and nationwide. The invoicing process for the first round is still ongoing, and we are also setting up the second round. Over the course of the last year, in response to the COVID-19 pandemic, people across the nation have migrated more aspects of their daily lives online, including healthcare visits and treatment to slow the spread of the COVID-19 virus. As a result, telehealth has exploded. And in December 2020, Congress appropriated $249.95 million to the of additional funding to the FCC COVID-19 telehealth program. And then in January, we sought comment on the application and valuation metrics that Congress that would be used to ensure the equitable distribution of additional funding that was recently provided. In February, we adopted an initial report and order, which expanded the responsibilities of the Universal Service Administrative Company. They will be administering the second round of the COVID-19 telehealth program. And then at the end of March, the commission adopted and released a report and order establishing the policies and procedures that will govern the round 2 of the COVID-19 telehealth program in accordance with congressional guidance. So we established an application filing window. We announced yesterday that it will be open starting April 29th at noon, and then it will close on May 6th at noon the following Thursday. Establishing an application filing window will facilitate a more efficient and equitable application review process. During the first round, we reviewed applications on a rolling basis, considering hardest hit as one of the primary factors of our review of the applications. So with this application filing window, USAC, with oversight from the Wireline Competition Bureau, will review all applications from eligible applicants based upon the 9 predefined evaluation metrics, and will award funding to the highest scoring applicants after they've conducted their review. To give you a little more detail about the objective application evaluation metrics that were established during this round, we have the commission has provided both a list of the metrics and the associated prioritization points in the report and order that was released at the end of March. The evaluation metrics are as follows. If the applicant is in a hardest hit area, they can receive up to 15 points. If they're in a low income area, they can receive up to 15 points. If they're a applicant who applied during the first round but did not receive funding, they may receive up to 15, they will receive 15 points. If they are a tribal community, they will receive, I have 15 points written here, but for some reason, I think it may be 10. Let me double check that.
Hey, Stephanie, I copied it. I put a slide up there for you. So it is 15. It's correct.
Okay, good.
Yeah.
I'm glad my notes are right. Sometimes I get a little, there's a lot in my head these days. Critical access hospitals receive 10 points. Federally qualified health centers, federally qualified health center lookalikes, and disproportionate share hospitals receive 10 points. Healthcare provider shortage areas, 10 points. Round 2 new applicants, so applicants that didn't apply during the first round, will receive 5 points. And then rural areas will receive 5 points as well. The report and order that we adopted in March also established a dual phase commitment process to allow applicants an opportunity to supplement their applications. So during the initial commitment phase, we will first award funding to the highest scoring applicant in states that were not funded during the first round, Hawaii being among those 4 states that we did not fund during the first round. We will also make an effort to, if applicable, fund all states during the initial commitment round. And then from there, we'll rank and fund from the top down up to an amount of at least 150 million. At that point, we will send notifications of intent to deny to the remainder of the applicants that did not receive funding commitments. They will have an opportunity to supplement their applications. And then at that point, we will re-rank, or USAC will be re-ranking as necessary, depending on whether or not folks submitted supplemental information that increase their score, and then we'll be funding from the top down again for the remainder of the funding. So in the March report and order, the commission directed USAC to commit funding, as I mentioned before, the highest scoring applicant with a lead healthcare provider in a state or territory that was not funded during round one, during the initial commitment phase, and then to commit funding to the highest scoring application from each state, territory in the District of Columbia. During that initial commitment phase, and then to also fund again, so the unfunded. So really it's the 4 states that did not receive, and any territories that did not receive funding will be funded first. And by that, I mean just put into that first initial commitment phase bucket, as well as all the states, territories, and DC, if there are applications from them. And then, so that will all be part of the first tranche of funding commitments that will go out. The March report and order also established an eligible services list to provide some additional clarity about what services and connected devices are eligible under the program. We also directed USAC to provide outreach and education to stakeholders. USAC is currently in that time period of providing outreach and education, so I encourage everyone to go to USAC's website and to their COVID-19 telehealth program page, and to sign up for their email listserv, which will provide additional information about trainings and other materials that they're putting out prior to the window opening on April 29th. I'll put that information in the chat window in a minute. And then the last thing that the report and order did was it maintained a number of the existing COVID-19 telehealth program requirements. So the requirements regarding the eligibility of healthcare providers, some funding limitations, procurement processes, compliant audits, and the post-program feedback reports. Accordingly, only public and nonprofit healthcare providers may receive funding under the second round of the program. This includes teaching hospitals, not-for-profit hospitals, rural health clinics, community health centers, mental health and migrant health centers, community mental health centers, local health departments, and skilled nursing facilities located in both rural and non-rural areas. And then for the invoicing process, the commission directed USAC to use the same invoicing process and reimbursement structure for round 2 that was used during round 1. Now, I know there were some specific questions that were posed to us before, were sent over before the meeting. I'm happy to provide those answers now, if that makes sense, Christina.
Yes, thank you. So
Sure.
yeah, I think I did want to note that although it's very early in the morning, I do see some of our Pacific Island participants on. And so one of the first questions that we had that came to us was really regarding the compact Pacific Islands, right? Those would be Federated States of Micronesia, Republic of Marshall Islands, Republic of Palau. I know the report and order says that it is the states, territories, and DC. And so it was just a confirmation. They're just asking again to make sure that this the compact Pacific Islands are not eligible for this program. That was the clarification it was asked.
Yes, that's right. It is limited to U.S. states, territories, and the District of Columbia.
Okay, thank you. So that was clear. Sorry, you can go ahead. That was just the first one I wanted to address, but you can go ahead with the rest of the questions.
Sure. The next question was about eligible devices, whether ultrasound machines that are connected to telehealth networks for transmitting images are eligible devices. Connected devices that are used to provide telehealth services are eligible under this program, and we did not make The only change we made to the eligibility of the services and equipment underneath the program were to reimburse for 12 months of recurring services rather than 6 months of recurring services. And I've seen on the round one invoicing side, all connected ultrasound devices funded in the past. So, based upon that, I would, it's hard to be absolute, but I feel confident that, similar devices would be funded under round two.
Absolutely, thank you.
Sure. The next question was whether I can confirm that tribal lands include Hawaiian homelands, and that's right. Under the definition used for the tribal evaluation metric adopted for round two of the COVID-19 telehealth program, tribal lands include Hawaiian homelands. It's a codified definition. I can provide you that citation, but I feel like that's just a string of numbers.
Okay.
The next question is whether dark fiber and network equipment costs are eligible items. So build-out costs are not eligible under the COVID-19 telehealth program because it's a short-term and emergency program. But network equipment needed to use the telecommunication services, information services, or connected devices are eligible. I'd have to have a little more information about the specific network equipment costs that you're referring to know whether this is one that is needed to use the telecommunication services. But in general, network equipment is an eligible connected device or an eligible equipment underneath the program. And I think I covered the applicant service eligibility, the process for the application. I could provide additional information on that piece if you would like. So the application itself is on the FCC's web, hosted on the FCC system. It's the application portal is online, and folks, to apply for this program, there are 3 key things that need to be done prior to applying. You need to sign up for an FCC registration number. That's through the commission registration system. The next is you need to register for the Federal System of Award Management. That's separate from the FCC, but is because the funding is in the U.S. Department of Treasury, and the Federal System of Award Management is sort of a clearinghouse for getting funds from Treasury to entities. That registration should be done before you apply. And then the last piece is receiving what is called an HCP number, a healthcare provider number. And you can receive a healthcare provider number by filing an FCC Form 460 with USAC. That will allow you, once you file the form, the HCP number is generated. USAC then reviews the entity to see whether or not it is eligible under program rules. After USAC concludes its review, you'll receive an approved eligibility determination that'll be associated with your HCP number. But the HCP number is important because you need it to submit your application. And then the application itself, we've asked that folks provide specific information which will help us validate each evaluation metric. So beyond, name of the applicant, there's also, the name and of the lead healthcare provider, which could be the same person as the applicant, but not necessarily. If you're a large healthcare system applying upon many applicants, then you just pick one to be your lead healthcare provider on your application. And the lead HCP is special because they're the only ones that need to have an approved eligibility determination. They're the only ones that have to file an FCC Form 460. Everyone else, the applicant will certify on their application that the entities receiving funding requested on the application are eligible. It was
Stephanie, on that point, I think that's a really important point. So for the application that's being submitted, there should be one, at a minimum, confirm 460 kind of HCP number. But if you have like a network and you have many other sites, at the time of the application, they don't necessarily have to have completed their 460 approval. Is that correct?
Yeah, so at the
Okay.
time of the application, when you're applying, when you're submitting the application, the eligibility determination process doesn't have to be completed. You just have to have applied and received that HCP number. Then during the review process, you'll have to have an approved eligibility determination at that point, but only for the lead HCP. Every other entity for which the applicant is applying for funding, the applicant is guaranteeing and certifying that they're eligible. The final list of all sites that receive funding isn't due to USAC or to the FCC until the invoicing process. And at that point, all the eligible entities will be listed on a letter of authorization, just to show us where the funding went, because we recognize that there's still a lot of uncertainty and needs may change. So one of the reasons why we only required the lead HCP to be listed on the application instead of all of them was to afford healthcare providers additional flexibility in where they're directing money, as situations on the ground change.
Yeah, that's really helpful. I wanted to know, I'm not sure if you are familiar with all the other programs, but is that the same for the other programs, or is that a new change? Like, for example, the Connected Care project and some of the others that we propose networks, because it's very useful. You're right. Like from the time of the application to when you're ready to implement, sometimes there are site changes or other needs that develop, and so that's I think that's a really good point on this actual COVID-19 telehealth program.
So we did pull it from it was an idea that we pulled from another program. I believe it was the Connected Care pilot program, but I'd have to go back and double check that.
Okay, great. Okay, yeah, and actually I think, I think this is a good time to also remind the participants that this particular FCC initiative, because there's so many right now, is the second round of the COVID-19 telehealth program. And as Stephanie mentioned earlier, and you can correct me if I'm wrong with the dates, the actual application filing window will open on April 29th, you said, and it will close on May 6th.
That's right.
Is that correct? Okay.
Yes.
Okay. Okay. So let's see. I'll see if there are any questions right now for the team. Okay, so there's a question from CNMI. Good morning, Shibroto. He asked, should these filings be completed before the application window? Oh, sorry, opens later in April. Oh, sorry, Shibroto, your question was answered, right? So she was saying it would be due for the 460. It would be due. It's due during the invoicing process.
So you're saying for Form 460s for other eligible entities?
Oh, okay, yeah, that's a good question. Maybe you can answer that question for the other eligible entities.
So we don't anticipate that the other eligible entities will need to file a Form 460 in order to list them on the letter of authorization. We're relying on the certification and the lead healthcare provider's eligibility determination for both for the application, and then as well on the invoicing side. We have pretty strong under penalty of perjury certifications, but we will be looking at, obviously to prevent any ineligible entities from slipping in, we will be looking at those entities as well. So you will want to confirm that these entities fall within the parameters outlined in the program, meet the requirements, are nonprofit or public institutions.
Okay.
But the other forms, but the Form 460 for the lead healthcare provider, yes, please start filling that out now for the SAM registration and for the FCC registration number. I encourage anyone interested in applying for round 2 that doesn't already have these things completed to please, start them today so that they can be, you can have all your ducks in a row for when the application filing window does open.
Okay, so that's a really important point, is that although all sites on your network does not have to go through the eligibility process through the 460 form, the lead applicant does. So that's something, if you don't have a Form 60 now, really need to get started to go through that process now through the FCC website. And for the other sites, it sounds like you're doing a certification. Do you know, is that something that is a form that they need to complete or provide additional information? I know when you go through the 460, the FCC does a very thorough search in your the site website. They do like all these geolocation to confirm you're really at the place of the address. I mean, it's a pretty thorough review. So in this case, it sounds like the certification might be, as you said, almost self-determined to to confirm that you meet all of the eligibility criteria as a
Yes, so the certifications are both included on the application form and then also on the invoicing form themselves. And you'll be required to list the healthcare provider names and the letter of authorization that you submit during the invoicing process. But it's less robust. We don't need your website information. We may Google it. But the name, the street address, the city, state, and zip code is what we're requiring on the letter of authorization so that we can verify that the entities are eligible.
Thank you. That's very helpful. Okay. There is a question in the chat from Kael Tan. Is there a maximum award cap for the submittal?
Yes, so we do not anticipate awarding more than $1 million per applicant, just as we did during round 1. But if a large healthcare provider decide they have flexibility, so if they want to apply on an individual basis versus a system-wide basis, we leave that up to the applicant.
Okay, great. Thank you. There's another question asking if there's a website to access all the required forms. And I can ask if someone from the FCC has that handy, or I can ask Ginger Porter from our team to drop that in the chat as well. So the website for where they could start the application process.
Yeah. This is the USAC's website. I just added it to the chat that provides additional information about the program. There's also a link there for folks to sign up for their email outreach, which will provide you with trainings and other information. And we expect this website to become more robust in the coming days as we gear up for round 2.
Great, thank you for that. Another question is, I think this is related maybe to the definition of telehealth platform. That's an eligible cost item. And the question is, can these funds be used for moving to a new EHR that has telehealth services built in?
I'd have to get a little more information about that service. I think I'll leave it at that. I need a little bit more information just about the service.
Okay.
But I'm happy to direct people to, and here's USAC's to telehealth support email inbox. That to the chat, and you can ask questions about eligibility as well as any other programmatic questions.
Okay.
Make sure that's right.
Other questions? I did have a question in round 2. I think I did see something about retroactive payments to March 2020.
Yes, that's right. So
Yeah,
if you purchased information telecommunication services or connected devices to respond to the COVID-19 pandemic from March 2020 until during that duration, we will fund those retroactive payments. Those services, within the subset of eligible services.
Okay. Does this program require the competitive bidding in the same format as other FCC programs?
No.
Okay. I'm just assuming for the university and state people, we'll still have to go to all of our state and university procurement. So that doesn't waive it for us, but it is not, the 30-day, competitive bidding window for the FCC. Okay, thank you. Let's see, there's another question saying, does the HCP need to be an MD or a DO? So they're asking for the healthcare provider, in my understanding, is the entity, the organization. So it's not necessarily a medical doctor. That is not a requirement of the HCP applicant, or that's the question, I guess.
I need additional information. We do provide skilled nursing facilities are also eligible. So I'm trying to think of other non-medical doctor facilities that maybe community health centers are eligible.
Yeah. So Judy, I'm not exactly sure, but this might be helpful. The list of eligible sites, and I'll just put this up real quick. So these are like what they call HCP sites, right? And this is the list of the eligibility. So post-secondary education institutions offering healthcare instruction, teaching hospitals, medical schools, community health centers, or health centers providing health care to migrants, local health departments or agencies. This one always tripped us up in Hawaii because we have one state Department of Health and we don't have actual local departments of health, but our Department of Health is eligible. Community mental health centers, nonprofit hospitals, rural health clinics, skilled nursing facilities, and a consortia of healthcare providers consisting of one or more entities falling into these categories. So Judy, I'm not sure if that helped in terms of when we refer to HCP, healthcare provider. Okay. Let's see. Oh, okay. So she's just saying specifically the HCP who applies for the lead. So as long as they're one of those eligible sites we showed up on the screen just then they would be able to serve as the lead or as a site. Okay.
That's right. That's right.
Okay, thank you. Any other questions? Okay. I don't see any questions coming in chat. I'll just take a look. Let's see. Okay. Okay. I'll just go around. Oh, one more came in. If COVID-19 quarantine is provided in another state, but the applicant is in another state, would those costs be eligible? I'm going to ask Ginger if you can ask your question. I'm not sure I'm able to.
Yeah, sorry, I was trying to, kind of rush the typing, but so, several things with this one. So the American Samoa is a low risk area, right? Because they absolutely have 0 cases. So looking at what is used now to evaluate these applications, that is going to be a zero, like no points for them. But they are running COVID quarantines for a repatriation program in a different state, in the state of Hawaii. So, just there, that's the kind of the bigger risk, right? But in that quarantine facility, definitely there's a need for providers, there's a need for in-house services, telehealth services for different things. We do health wellness checks, we do, just general consultations between providers and the travelers or participants of these programs. A lot of those costs are on people's devices, on their own MiFis or something like that. Some of them don't. Some of them don't have the devices to connect. So, in a situation like that, would the devices, the connected devices or the tablets, would we be able to offer that kind of service as well as the connectivity to provide that service? I mean, would that be something that's an eligible cost under this funding source?
So yes, services that are, in response to the COVID-19 pandemic are eligible under the program. So it sounds like what you're describing is something that you're doing in response to the pandemic. So that sounds like it would be covered. And I wanted to clarify too that hardest hit area is just one of 9 metrics. So that's 15 points out of 95. So, we anticipate facilities that qualify as low-income areas, that are tribal communities, that have critical access hospitals, that are in rural areas. There are at least 6 metrics that have nothing to do with hardest hit area, and that quite frankly, way more points wise than hardest hit would.
Okay, thank you. Sorry, there's another question that came in. Would vendor maintenance services for an eligible connected equipment be an eligible cost?
I just happen to have a eligible services list in front of me.
Okay, great.
We attached it to the report and order as Appendix B.
Okay.
And I believe that maintenance costs are ineligible. Yes, that's correct. So technical support, maintenance costs, and then separate costs for warranties are not eligible under the program.
Okay, thank you. Would Native Hawaiian health care systems qualify as an HCP? We can answer that. Yes, they have received FCC funding before. So Nicole, that is yes, correct. And if you're serving population on tribal lands, which Stephanie confirmed includes Hawaiian homelands, then you have some extra points in there. It was 15, right? That's what we clarified. Okay. Okay.
Yes.
Yes, Stephanie, sorry, if you could, you mentioned the attachment in the report and order. Was it attachment B that includes a list of, because that's a really important key document. I think that as people are planning their projects, they're going to want to refer back to that.
Yes, both attachment, so it's Appendix B has the eligible services list, and then Appendix C is has a list of all it's the application process guidance, and it provides information on how you get an approved eligibility determination, how you obtain an FCC registration number, how to register for SAMs, and provides also information about what we're collecting on the application itself for each of the metrics and in general, so that you have a sense of what information you need to pull together before you sit down on April 29th at 1 p.m. or, well, it's noon, right? Noon Eastern time. So you guys may do it a little bit later because I feel like you'll still be asleep. But to apply. Yes, that's right. Thank you for sharing that.
Yes, for those of you, she couldn't really go through all of this in this presentation in detail, but it's really important to see where it's found in the report and order here. I think this one, what you said was Appendix C, right? Yeah.
That's correct.
And
Yeah.
so here is that list she's talking about of all the things that you're going to need as you go through the application. So that's very helpful. And Appendix B lists the eligible cost items.
That's right. And we also give some details about what isn't eligible,
Right.
because we provided sort of a high level description of what is eligible, knowing that there are a lot of things that fall under the umbrella of telecommunication services. So those are more on the eligible piece, representative examples, and then we also provided information about what costs we don't cover.
Okay, perfect. And then there's one thing I think you mentioned already, but I really want to emphasize for our state and territories that there will be at least one award per state and territory. So we're trying really hard to encourage everyone to apply. I wanted to just again acknowledge, when we started this session this morning, it was 5 a.m. in CNMI, and we have people who were so excited to get this information that they have attended. So just to let you know that. Oh, I guess that brings up one other question in terms of the closing, the window when it closes. Is that according to like midnight on Eastern Standard Time or according to our local time zone, or is that something we can?
It's Eastern time. Yeah,
Okay.
That's right. So it's actually noon. It's 12 p.m.
Oh, okay.
So it opens noon, April 29th, Eastern time, and then closes on May 6th at noon, 12 p.m. Eastern time.
Okay, great. Thank you. So Sharota, I don't want to put you on the spot, but we're going to have to do all the time conversions because they're one day ahead and so many hours back, right? So we'll just make sure we got the time zones figured out so we don't miss deadline due to time zone differences.
Yeah, we'll just back it up a day and be safe. Yeah. Thanks,
Yeah.
Christina.
Or we'll apply before the last date. We're going to tell everybody that it's like 2 days before the actual deadline. Okay. Well, we did say maximum of 45 minutes. I don't want to take advantage of your time because I know that you are all extremely busy and have many details to keep in order. And we just wanted to say, thank you so much for taking the time to come here to meet us this morning, to share this information, and mostly for supporting this program. It's such an important, really good program. And all of the really amazing things coming out of the FCC. Hawaii is so excited about it. We have a EBB working group, and we've got people really excited about that because in telehealth, especially, one of the main problems that we hear is it works well if the internet is reliable, if my patient has an email, and if they can get access. Otherwise, it doesn't work at all. And that's really for our most rural and vulnerable populations that we're having these problems. And so the FCC is coming up with solutions for things that we can't solve. We can't really solve on our own. It takes a long time to try to build infrastructure and all of that. So we're trying to take advantage as best as we can of these programs, and this information you provided today is so helpful. So I wanted to just acknowledge the FCC team that's on. So maybe Lori, if you want to just do a quick, because you have a big team on today, if you just wanted to, or Stephanie or Lori, do a quick introduction of those that are on. We just want to say mahalo, thank you, and to you, Megan. But I want to just acknowledge the rest of the FCC folks that are on the line today.
I don't know if there's any other FCC people. I'm Lori Morbier. I'm the Legislative Affairs Office, and Stephanie is the obvious expert in all of this. So, but I don't know if there's anybody else from the FCC on at all.
Okay, I'll turn it over to Megan for her team.
Sure, yes. This is, Megan again, and we have Kulu and Ishan from the tech team as well joining us.
Yeah, and thank you so much for your support. Really appreciate that as well. So with that, I'm just going to close out the session for this FCC briefing. You all can stay on if you want to, but the telehealth, we're just going to go over some other information that we want to share with our stakeholder group. And again, mahalo, thank you so much. And we'll get our applications in.
Fantastic.
Okay.
Thank you for having me. It was a pleasure to speak with you all.
Thank you so much, Stephanie, Lori. Okay, thanks, Megan. Okay, so we just have a few more minutes before the end of our session today, and wanted to just see, does anybody have any more questions that you might want to talk about further regarding this FCC COVID-19 telehealth program? One thing that we have done that might help to stimulate ideas is take a look at the round 1 funding awards and the type of programs that were funded. So we saw there's a list, we can share that as well. There's a list of the type of networks that they funded and equipment, and it was a lot of, laptops, MiFis, remote monitoring type of things. Teledentistry, Shabrota, was interesting, but again, if the device is not able to be connected, like to broadband or internet, it's not an eligible item. So I think there were some ideas about like sleep studies, but that doesn't, remote sleep studies, it's not eligible if you collect the data and then, submit it. It would have to be something that's actually connected up. So that connectivity piece is important. So any discussion or questions or anything before we go on to just a few announcements before we close? Okay, so why don't we go to the next slide, Boomerang. We did want to point out that on PBTRC.org website, if you take a look at the resources page, we have a new broadband resources section. So under funding opportunities, there are federal grants, but then we have the FCC Emergency Broadband Benefit Program. And I hope Laura's still on, so she can mention that in a little bit. There is also the regular FCC Rural Healthcare Program that you can get discounts, I believe, up to 65% on your connectivity. That's just an ongoing program. It's not special for the pandemic or special congressional funding for this period. It's actually ongoing. And then this FCC COVID-19 telehealth program, this link provides you to a summary of all of those that Ashley from our team had written up, but then it gives you directly to the official website links where you can get the resources directly from the FCC. And then just wanted to point out here that the USDA Distance Learning and Telehealth Grant Program is open again. The window's already open. One more thing I wanted to point out here, and if someone from my team can drop the web link for this Google form in the chat. This is broadband and digital equity projects. This is the state of Hawaii. I apologize for the territories that are on the call today, but the state of Hawaii has organized this broadband digital equity projects form to collect shovel-ready projects that relate to broadband, so telehealth would be included in that. The reason that they're collecting this is because they're trying to make sure that you get all the information on any kind of broadband or infrastructure or telehealth grants that are coming down. There's lots of funding coming down from the federal government, and sometimes hard to track. And sometimes even at the county or state level, funding opportunities come up at the last minute, and we're just scrambling to find shovel-ready projects. So instead of being reactive, we're trying to be proactive about it. This comes out of our Hawaii Broadband Hui group. So this link right here that Umarang posted in the chat will get you to this form, to just simple contact information and your project so that you can be contacted if there's funding opportunities related to that. Next slide. So for this one, Laura will probably be reaching out with more resource materials, Laura Arcibal from Department of Health. But I really want to take this opportunity to just go over some highlights on this FCC EBB, Emergency Broadband Benefit. You're going to be hearing a lot about it. It's $3.2 billion of funding. This is really, really important. It will provide at the individual, household level, $50 a month for a discount off of their broadband. And if you are in Hawaiian homelands, it would be $75 a month for households. All of our carriers are participating in this part of the program. There's another part of the program, and maybe Laura can give us an update. I'm not sure if any carriers signed up. Another part of the program is a one-time discount for those households up to $100 of a device. But there is a criteria. You either have to have one child in the household that receives free school lunch program, someone who has received a Pell Grant, if someone has been out of work, I think for about six months period of time. So there's a criteria of need, primarily focused on economic need. So Laura, do you have any updates on this initiative? Any of the telecom carriers participated in the second part on the devices? Uh-oh, maybe Laura had to drop off. So sorry, I don't see her on anymore. Okay, so we can let you know if there's updates on that. And then the next slide. So Cyril, can you just talk about the languages translation project that we have?
Okay, yes. So PBTRC, we developed some resources specifically for patients on how to connect up on Zoom and Doxy.me. There are two instructions for Zoom, one for if the patient is using their computer or if they're using an iPad or iPhone device. So you can find the link in the first page of pbtrc.org. It's in the translation toolkit, and we translated it into 9 different languages and currently working on providing Vietnamese and Japanese. So that should be up soon.
Okay, thank you, Cyril. And I think the last slide is just a reminder that we would like to invite you to join us next week, Friday. This is not about funding, but maybe it's about something that you can plan for funding if there's a need in your organization for teledermatology. So the topic is The Landscape, the Controversies, and the Hope by Dr. Toby Maurer. She has done many years of teledermatology based in San Francisco. On her team, she has a doc from Maui, and so they were very interested in working with providers in Hawaii. So we have sent this out, and please register. It's same time next week, Friday, 9 to 10. If you also have come to find us, but you're not on our listserv, please drop your email address in the chat and we'll add you to our listserv so that you get these announcements on a regular basis. Okay, so that's all that I had today. I just wanted to thank all of you. Oh, I see Sylvia on, so I want to give her an opportunity also to just provide any updates on resources that you have that you would like to announce, Sylvia. Okay, I didn't warn her. Okay, go ahead,
Yeah.
Sylvia. Or just if you wanted to talk about any of your new resources as updates for those that are on the call today.
Oops. So we have a online self-directed telehealth training course for family advocacy staff or program staff that work with families that want to get a good foundation of telehealth so that they can help guide their families. And it's at familytelehealthtraining.org, I think. So they can register, go through the training, and then at the end, they get a lovely certificate of completion. It's free, and it should work fine now that we have load balancing on our website. Also, as part of that new website, we have family resources. So this is all geared towards families. Our What to Expect from a Telehealth Visit has now, we uploaded the Vietnamese version of it. So it's in English, Spanish, and Vietnamese. Ginger is kindly working with my staff to make the Samoan version of it, which the first draft has been completed, and Ginger is just helping with making sure that the graphics look good. And then we have Mandarin, Cantonese, Korean, Tagalog, Ilocano, and Russian on in the lineup for getting that. And so that's the video to help families understand how to set themselves up and prepare for a telehealth visit in their home.
Thank you, Sylvia. And the reason she has such a variety of languages is because the resources for the whole Western region, right? Okay, well, that brings us up to the top of the hour. I'll just stop to see if anybody has any other resources, information to share, or questions or comments before we close today. Okay, I don't hear anything, so I want to thank all of you for joining. If you do have questions as you go through the application process, the FCC does have a site you can call, but if you want to run it by us as well, Ginger Porter on our team has been working with a lot of these FCC programs and is very familiar with the various forms. Some of it is a little changed, slightly changed, but if you have questions, please feel free to reach out to us. And with that, we'll close the session. Thank you again, everyone. Have a good day.